Occupational English Test. Sample Test 2. Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information you hear. Now look at the notes for Extract 1.
Extract 1. Questions 1 to 12. For questions 1 to 12, complete the following notes with a word or short phrase. You now have 30 seconds to look at the notes.
So, what do we have today? I see you made the appointment for lesions on your hands. Is that correct?
Yeah, I kept thinking that they would go away, but that hasn't happened so far. Also, this isn't the first time this has happened, so I figured I should get it looked at.
Yes. So how long has it been since this latest outbreak of lesions started?
About 5 days ago.
I see. Any change in diet or medication?
Yes, I took ibuprofen for a fever about 12 hours before the lesions appeared.
So you mentioned having had these lesions before. Did you also take ibuprofen before that time?
Yes, I was taking ibuprofen for 3 days before the lesions appeared.
And did those lesions appear on your hands as well?
Yeah, same location. That time the lesions healed after a few weeks, but there was a little bit of a mark left.
Yes, I can see the residual hyperpigmentation. Did the lesions hurt at all?
Yes, there is a bit of a burning sensation.
Okay. Have you ever had any adverse reactions to other medications?
Not that I can think of. Do you think it's definitely related to the ibuprofen?
That seems like the most likely explanation. We will have to confirm, but I suspect that you have what is called a fixed drug eruption, which is a common immune-mediated mucocutaneous reaction to the consumption of a variety of different medications, including ibuprofen. Many patients forget about having taken over-the-counter drugs, which makes diagnosis more difficult, so it is good that you have kept track of what you have taken. It definitely makes my job easier.
Yes, I am usually quite careful about what medication I take. So you said something about confirming the diagnosis. What would that involve?
There are 2 possibilities. The more invasive approach is to do a small punch biopsy to examine the epidermis and upperdermis. This would have been the best option if you hadn't told me about your medication history, or if you had an unusual presentation. The less invasive approach is a provocation test, which would use an oral challenge to check for lesion recurrence. Since you're fairly certain that you've only had a reaction to one medication, it should be relatively easy to confirm the medication responsible for your condition.
Sounds pretty straightforward. So, what about treatment? I mean, the lesions do seem to go away eventually on their own, but is there anything that can be done to help them heal faster?
Yes. Since your lesions are in non-mucosal areas, we can use a topical corticosteroid therapy, as well as an oral antihistamine, which should reduce the burning associated with the active lesions. Also, of course, once we confirm ibuprofen as the cause of your fixed drug eruption, we will find an alternative medication for fever management.
So anything else I should be on the lookout for?
Yes, people with fixed drug eruptions tend to be triggered by more than one medication, so I advise you to closely monitor how you react to any medications you take, in particular antibiotics, NSAIDs, analgesics such as acetaminophen, antifungal agents, uric acid reducers, and omeprazole.
So this condition is definitely something I should bring up whenever I'm prescribed a new medication.
Yes, that is certainly the case. It would be important information for any physician treating you.
For questions 13 to 24, complete the following notes with a word or short phrase.
So, do you have an explanation for what is causing my stomach pain?
I think that I do, but before that, I want to confirm a few details about your medical history and current condition. So, according to your chart, you have been experiencing abdominal pain for a week. Is that correct?
That's right. I went to my GP 2 days ago and he prescribed me ranitidine, but that hasn't helped at all. I'm still in pain and feeling nauseous, and now I've started vomiting and feel bloated.
Have you experienced any pain after eating?
No, the pain does not seem to be related to eating. It has been pretty constant over this last week.
Okay, and you have diabetes.
Yes, I was diagnosed several years back. I take glyburide for my diabetes.
And now to your current condition. The first physician who attended you noted some mild tenderness in the mid-epigastrium and right upper and lower quadrants. Also, I just got your blood test results back, and everything was normal, aside from your blood glucose level. I have examined your radiography, and it appears that you have what is called a gallstone ileus, which is a type of mechanical small bowel obstruction.
I have gallstones, is that what you're saying?
Yes, in your case, because of chronic cholecystitis, which caused an inflammatory fistula, the gallstone was expelled into the intestine and got lodged in an area of intestinal narrowing, causing bowel obstruction. Your radiography indicates that the gallstone is quite large, about 3 centimetres in diameter.
Oh my, does this happen a lot?
No, actually it's quite rare. Gallstones cause less than 1% of bowel obstructions, but I do have to tell you that it is a disease of the elderly, so your age played a role in the development of this condition.
Well, at this age, everything stops working correctly. So what does this mean now? Will I need surgery?
Yes, you will. First, we will want to get your fluid and electrolyte imbalances taken care of. This condition is also often a sign of the condition I mentioned, chronic cholecystitis, which we will have to consider as we decide on your treatment plan. This condition can cause chronic inflammation and, as a result, the gallbladder could rupture, which would be a serious medical emergency. For this reason, removal of the gallbladder is a common course of treatment.
OK, so what are the possible side effects of taking out my gallbladder?
Well, that depends on...